Welcome back to ESCMID TV. We're with Pelagia Magiorakos from the European Centre of Disease Control, who's just presented a paper this morning on day 2 of Congress about the year in infection control. Although, Anna, you were fairly specific in your own particular paper. What was it all about?
Well, I decided to focus on the resistance in gram-negative bacteria, and with a focus on extensively drug-resistant and pan-drug-resistant bacteria. Over the course of the last year, there have been some really interesting articles showing the occurrence of carbapenemases in Klebsiella and E. coli and the spread across Europe, and really what the real-time situation is, and the presence of which types of carbapenemases. This was a really good study, actually, that was funded by ECDC, and it was the European Survey on carbapenemase producing Enterobacteriaceae. Other things that happened this year also were the continuation of reporting on the MCR1 gene that provides colistin resistance, mostly in E. coli, can be found on plasmids and is very, very highly transmissible. Other things that we have seen in the literature are actually information on the duration of antibiotic, the duration of colonization in patients and what their risk factors are. So through travel, we found carbapenemase-resistant Enterobacteriaceae in returning travelers who were otherwise healthy. We have also reconfirmed the presence of ESBLs in these patients, and also we've seen MCR1 genes in long-term care facility patients, which is quite alarming because we know that these patients are admitted to hospitals and readmitted to nursing homes, so there's a back and forth loop. We've seen that the duration of colonization in long-term care facilities can be up to 9 months. We know this from the literature previously, even from acute care facilities, and especially in patients who are burdened with other comorbidities. This is all very significant because it sort of paints a picture of a larger spread or a larger reservoir, and we have to keep that in mind when we think about patients who enter hospitals and how to consider them. Are they at risk for transmitting these bacteria into patients who are already in the hospital? I think what's really significant also, in addition to knowing what the status, the epidemiological status and burden is to know that there are guidelines to promote, that discuss how to implement and when to implement infection control measures, and we need to adhere to these strictly to be able to control the spread of these resistant bacteria. And also we saw a lot of studies also on antibiotic stewardship, the use of procalcitonin, the use of rapid diagnostics like Malditoff, and all these things can decrease the duration of antibiotics with positive outcomes for patients.
And C. diff raising its head once again.
And C. diff raising its head once again. Also a very interesting study showing that the prior use of C. diff in the previous patient who occupied the bed was associated with increased risk for the subsequent patient in developing Clostridium difficile infection.
So we've got to go unashamedly back to basics, even with something like C. diff.
Back to basics really means prudent use of antibiotics.
Yes.
Prudent use of antibiotics, prudent use of antibiotics. We really have to drill that into our heads, that we really have to know when to stop them and to use them correctly.
Brilliant. On a personal note, did you enjoy presenting?
It was fantastic. I'm very happy to be here. Yes, I'm really happy to be here, to be able to discuss with all of my colleagues, but also to perhaps make a difference and providing information to people who would be able to use it.
And you certainly did so. What an excellent presentation.
Thank you.
Thank you for being with us on ESCMID TV.
Thank you so much, Michael.
Thank you.